Welcome to the Somatic Movement Workshop, week 2. I'm so excited you are joining me for another week of this. And this week we're going to focus on the face. And so what I found, as I kind of talked about in the previous slides, we hold a lot of tension in our jaw and our eyes and our cheek and our oral floor. And so what I wanted to map this week are maybe some areas of your body that are a little bit ambivalent to you. You haven't really ever spent much time focusing on them. And so if you're gonna just kind of sense into where your front and back jaw hooks are. So if you run your fingers along the bottom of your jawbone all the way up towards your ears, and it's kind of tender in there, and just kind of when you can't go any further, this is the back jaw hook that we'll be mapping. And then if you run your fingers along your jawline, along your teeth, until you hit kind of like a big mass on your cheekbones, and you poke around in there, you will find the front jaw hook. And so that will be 2 points that we'll be focusing on, one side after the other. Now, in connection with the jaw, we are also going to map the trigeminal nerve, which has 3 exit points. And so the 3 exit points would be I never know how to pronounce this, the ophthalmic nerve, which is just at the very tip of your brow bone. If you just kind of feel around your eyebrows, and you just kind of give your brain a little bit more information on what it is that we're focusing on up here. And there is a little bit of a tender area right at the very tip of the eyebrow, and that will be one area that we'll be focusing on. And then the next exit point for the trigeminal nerve is the cheek branch, and so it's the maxillary nerve. And where it is if you run your fingers from your tear ducts all the way down to where the kind of flat spot is on your cheek, and you'll feel there's a little bit of a sensitive side to this flat spot, and this is where your trigeminal nerve lives on that spot. And then the third exit point is on the cheek, and so if you again run your fingers along your jawline and you work your way to the front, just before you hit that little bump that is the front of your chin, there's a couple of tender spots on either side. And this will be the exit point for the mandibular branch that comes out. It's the largest sensory nerve, and so it's a beautiful one to kind of activate and wake up some neural pathways, because this is how all your sensory information is going to come in, is through your senses. So yeah, beautiful. So how about we lie down with the feet flat on the floor and the knees bent, and so just kind of take inventory of how your back body is resting on the ground. Is there one side of your body that your brain has a preference for? One versus the other, and this is the side that we'll be starting on. And if it's helpful to you, just you can take your fingers to your front and your back jaw hooks, the point just right near the earlobe, and that really squishy, thick, muscular spot at the very end of your tooth line. And you can just either hold your fingers there, or you can just take your hands away and just hold your awareness in that area. And as you pay attention to the front and back jaw hooks for a minute or so, does one feel closer pulled in towards the body, Does one feel more towards the outside of the cheeks? Is there any tension that you notice? As you hold your attention on your front and back jaw hooks, is there any tension in your eyes? Can you feel anything change as you're holding your awareness there? The change that might happen in your body might not be specifically to the jaw. It could be an aching in the teeth, or a different way your tongue rests in your mouth. How your pelvis is resting on the floor, or your foot valve on the floor. And as you hold your awareness on your front and back jaw hooks, are you holding your breath? Moving your awareness from your jaw hooks in combination to the cheek point of the trigeminal nerve at the very bottom below your lip and between the tip of your chin. Hold your awareness on that little chin exit point as well as your jaw hooks, and just hold your awareness there for a minute or so and see if anything changes. Can you feel any tension in your oral floor, the tissues that are underneath your jaw? Is there any tension in your teeth? Is there any tension in your eyes or your forehead? And as you hold your attention on your jaw hooks and your chin point, does anything change? Moving up to the cheek branch of the trigeminal nerve, as well as your jaw hooks, holding either all 3 points in mind, your front jaw hook, your back jaw hook, and your cheek branch, or oscillating between the 3 points, moving from one to the other. Do you hold any tension in your face? How is the back of your head resting on the ground on that side? Are your hands gripping? How are your feet resting on the ground as you focus on your jaw and your cheek point? And as you hold your awareness there, does anything change? Moving up to the brow band, or the center point of your eyebrow, with the third trigeminal nerve exit point. trying to rest your awareness at the front of the brow band, in the middle of your eyebrow, your front jaw hook, and your back jaw hook. And breathe into that area. Do you feel any different? How are your eyes resting in your eye socket? Do you feel any more tension because of the focus in this area? Or has anything let go or relaxed? Is your tongue resting differently in your mouth? Have you felt any change on the skin of your forehead? And as you hold your awareness on your front and back jaw hook and the center of your eyebrow, does anything change? Taking a mental inventory of your right and left side. How is your back body resting on the ground? How is your pelvis resting on the ground from the side that you've been paying attention to versus the side that hasn't had any mapping attention yet today? Is any part of your hand gripping the floor? How is your foot resting on the ground from one side to the other? And as you hold your awareness on all those parts of your body, can you feel a difference? Moving to the opposite side of your body, taking inventory of how your foot is resting on the ground, how your pelvis is touching the mat or blanket you're sitting on or laying on. How is your shoulder blade resting on the ground? And how is your hand feeling on the floor? Moving up to the jaw hooks on this side. You can once again either take your fingers to rest on the front and back jaw hook to give your brain a little bit more information on where it is that we are focusing on. And starting with the chin point of the trigeminal nerve, exit point, you can oscillate between the chin point and the jaw hook. Or if you can hold all 3 points in your mind. And as you focus on that jaw hook, does it feel more pulled in towards the body? Is one side feel higher or lower than the other? Is there any tension in your teeth? How is your tongue resting on the ground in your oral floor? And as you hold your awareness on the cheek point of the trigeminal nerve and your jaw hooks on the front and back, Does anything change? Moving up to the cheek point of your trigeminal nerve, not the chin point, the cheek point. I might have mismapped that. Moving up to the chin point and holding your jaw hooks in your mind's eye while focusing on that little space that's mapped below your tear ducts in the middle of your cheek. And as you oscillate or hold both or all 3 points in mind, does anything change? Is there any tension in your eyes? Any tension on the eyebrows or the skin of your forehead? Does one side of the body feel heavier than the other? How is the back of your head resting on the ground? Moving up to your brow band, the center of your eyebrow, and again holding in mind your jaw hooks and the center of your eyebrows. Is there any tension in your eye socket? Does one eyebrow feel higher than the other, one lower? Is there any tension on the skin of your forehead? And as you hold your awareness there, does anything change? Take inventory of how your back body is resting against the ground. Do both sides feel more equal now that you've paid attention to both? How is your foot resting on the ground? What part of your pelvis is making ground contact with the mat or blanket you're laying on? And which part of your shoulder blade is touching the ground that you're laying on? Beginning with the movement on this side that we've just been focusing on, very gently lift your knee up above the ground and lay it back down to the ground, and completely relaxing your foot against the ground, your hips against the mat, your pelvic floor resting, and repeating this up and down movement of lifting the knee and setting the foot back down very gently while focusing on the jaw hooks. Can you feel your jaw shifting as you're lifting your knee? Are you holding your breath as you are lifting your knee and dropping it back down to the floor? Can you feel your pelvis shifting from side to side? And as you are lifting your knee and resting your foot back down. Does your jaw feel any different? Moving to the chin point of your trigeminal nerve and continually, gently lifting your knee just a few inches above the ground, setting it back down while focusing on the chin exit point of the trigeminal nerve. And as you move and rest your foot in between, does anything feel different? Can you feel your chin being drawn towards the outside of the body? Does it feel drawn upwards or inwards as you're lifting your knee? How does your chin feel when you rest your foot back on the ground? Continuing very gently to lift your knee, moving up to the cheek branch of the trigeminal nerve. How is your back body resting against the ground? Can you feel your cheek moving gently with the rocking motion of the pelvis? Is your cheek drawn more down towards the floor or towards the outside? And as you hold your awareness on both those points, lifting your knee and dropping it back down in the cheek branch of the trigeminal nerve, does anything change? Moving up towards the brow band, the center of your eyebrow. Do you feel any tension in your eyeball as you're picking up your knee and dropping it back down? Is there any tension on your forehead? Are you holding your breath? Resting your foot on the ground and switching to the other side of your body. Do you notice, if you take a mental inventory, does your side that you've been moving feel heavier on the ground than the other? How is the foot resting against the mat? Your pelvis against the mat? Your shoulder blade and the back of your head heavier on the side we've been focusing on than the other? And just take note, and then switching your attention to lifting the opposite knee very gently off the ground, focusing on the jaw hooks. Can you feel your jaw rocking down towards the pelvis as you lift the knee? Can you feel one side more of one jaw hook tenser than the other? Are you holding your breath as you're lifting your knee off the ground? Can you feel your center line shifting from side to side as you're lifting your knee? And how is your jaw moving with this rocking motion of the pelvis and the lifting of the knee? Does your oral floor feel any looser or any tighter than before? Is there tension in your eyes and the skin on your forehead? And as you lift your knee slightly off the ground and rest it back down on the floor, can you feel anything change? Moving on to the chin exit point of the trigeminal nerve, holding your awareness there as you are gently lifting your knee off the ground and setting it back down. Can you feel your chin tilting to one side of the body? Is it more tilting towards the outside or downwards? Is it staying stationary? And as you gently lift your knee and set your foot back down, does anything change? Moving up to the cheek exit point of the trigeminal nerve. Do you feel any tension in your breath? Any tension in your rib cage? As you hold your awareness on the cheek bit of the trigeminal nerve exit point, and gently lift your knee off the ground and rest your foot back down. Do you feel your head tilting to one side rather than the other? Can you feel your pelvis rocking? And as you gently move your knee up and down, does anything change? Moving up towards your brow band or the middle of your eyebrow, your third trigeminal nerve exit point. Gently lifting your knee off the ground and setting it back down. Do your eyes feel softer, resting inside the eye socket? Does the skin on your forehead feel more relaxed? Are you holding any tension in your rib cage? Can you feel your eyebrow tilting towards your hip or more towards the outside of your body? Or are you finding your body quite stationary? And as you hold your awareness on your brow band and resting your foot back on the ground, taking a mental inventory of your body overall and how it's resting on the ground. Can you feel any tension in your toes? How are the arches of your feet resting on the ground? The back of your pelvis feel heavier on one side than the other? And your shoulder blades, are they resting evenly? Is one higher than the other? Does your body feel heavier on the ground overall? Now moving to the next movement, starting on whichever side that your brain has a preference for, lifting your arm towards the ceiling. And as you're focusing on your jaw hooks, making a very gentle figure 8 pattern where you take the tip of your fingers towards your breastbone and then swerving them back up towards the ceiling and out towards the side and back towards the breastbone, down, up through the center, and down again. Just making a very gentle figure 8 pattern with your fingers while focusing on your jaw hooks. Are you holding your breath while you are doing this movement? Is there any tension in your rib cage? Do you feel any trembling in your pelvic floor? Do your jaw hooks both still feel drawn inwards towards the body? Can you feel your jaw gently moving with the floor of your hands? Moving up to the chin, exit point of your trigeminal nerve as you're moving your fingers gently in the figure 8 pattern. Is there any change in your breath, in your rib cage? Are your feet resting differently on the ground? Have you felt your eyes soften? Moving up towards the cheek portion of your trigeminal nerve exit point while focusing on just gently moving your fingers in a figure 8 pattern as you move up to the brow band. Is there any tension in your eyes? And then resting both of your arms on the floor. Taking mental inventory of both sides of your body. Does one side feel heavier than the other? Is the eye softer on one side than the other? How is your tongue resting inside your mouth? And are your teeth aching? Moving to the opposite side of your body, again lifting your arm towards the ceiling, focusing on your jaw hooks on that side, bringing your fingers down towards the breastbone and up and out towards the body and back through, making a nice big figure 8 with the tips of your fingers in front of your breastbone and in front of your body while focusing on the jaw hooks. Does one jaw hook feel more drawn in towards the body? Is your tongue resting differently in your mouth? Do you feel any more or less tension in your eye and your eye socket? Moving up forward towards the chin exit point of the trigeminal nerve, while moving your fingers in a figure 8 pattern in front of your chest. Does your chin feel like it is moving like a wave with your fingers? Are you holding any part of your jaw or your chin as you're doing this movement, or holding your breath? Moving up towards the cheek exit point of the trigeminal nerve. Is there any difference in your breathing? Can you feel your rib cage moving with this movement? And how is your breath in relationship to moving your arm gently in this figure 8 pattern? As you hold your awareness on your cheek exit point and moving your fingers. Moving up towards the brow band. How is your eyeball resting in your eye socket? How is the skin on your forehead? Is there any tension? Can you feel any part of your eyebrow move with the figure 8 pattern? And as you move your arms in this way, does anything change? Resting both your arms and both your feet on the ground. Taking a mental inventory of your body overall. Starting with the feet. How are your feet resting on the ground from one side to the other? The back of your pelvis floor resting on the ground. Your shoulder blades. Taking inventory of your oral floor overall. How is your tongue resting in your mouth? How is your jaw hanging in your face? How are your cheeks feeling? How is your breath? How are your eyes resting? And if you've had your eyes closed, if you open your eyes, is there any change in your vision? Are you focusing on something straight ahead, or has your peripheral vision changed? And how are you breathing into your back body after focusing on your face in this session? Slowly roll over to the side, taking your time. Getting up when you're ready. setting an intention for this practice. Thank you all for joining me on week 2, and have a wonderful sleep tonight, and I will see you next week.